Hi, this is George with 573 Medicine, and in this video we're going to be talking about inguinal anatomy. So let's get started. First, let's talk about the inguinal ligament. The inguinal ligament is this ligament right here, which is incredibly important and extends from the ASIS, the anterior superior iliac spine, all the way down into the pubic tubercle. The external iliac artery and vein will transition to the femoral artery and vein respectively past the inguinal ligament. Next, let's talk about the inguinal canal, which is this tube structure right here, just superior to the inguinal ligament. There is the deep and superficial inguinal ring, and the deep internal inguinal ring is considered the entrance of the inguinal canal, and the external or superficial inguinal ring is considered the exit of the inguinal canal. Inside of the inguinal canal, there are many structures. The genital branch of the genitofemoral nerve exists in both males and females. In males, the anterior scrotal nerve, a branch of the ilioinguinal nerve, provides sensation over the root of the penis and scrotum. And the spermatic cord is also inside of the inguinal canal, which contains the neurovasculature of the testes as well as the vas deferens. In females, instead of the spermatic cord, there is the round ligament of the uterus, which provides structural support for the uterus. And instead of the anterior scrotal branch of the ilioinguinal nerve, there will be the anterior labial nerve, which will provide sensation to the skin, covering the mons pubis and labia majora. So next, let's talk about the layers of the scrotum. So most superficial, we have the skin. Just deep to the skin, we have what is called dartos muscle. And dartos muscle is incredibly important because it assists in spermatogenesis because whenever it is cold outside, whenever the scrotum is in a cold environment, the dartos muscle will actually contract and move the testicle closer to the body in order to retain heat, and that temperature is important in ensuring that spermatogenesis goes accordingly. Deep to dartos muscle, we have the external spermatic fascia. Deep to the external spermatic fascia, we have the cremasteric muscle and fascia. And the cremasteric muscle and fascia is incredibly important. So not only does it cover the testes and spermatic cord, but the L1, L2 spinal nerve reflex is tested using this muscle, and it's called the cremasteric reflex. Basically, if this reflex is normal, the inner thigh is going to be brushed and cause the scrotum to raise. And this is because the sensory ilioinguinal nerve and the motor efferent, or the genital branch of the genitofemoral nerve, must both be intact in order for the cremasteric reflex to work. And then deep to the cremasteric muscle and fascia, we have the internal spermatic fascia. Next, let's talk about the testes and sperm. So sperm is made in the seminiferous tubules of the testes. And from the seminiferous tubules, it will travel into the epididymis. And from the epididymis, it will move into the vas deferens or ductus deferens. And from there, it will move into the prostate, like the prostatic urethra, where it will get prostatic fluid, then it'll move into the urethra and then the penis. The next structure is going to be the tunica albuginea. The tunica albuginea is the fibrous covering of the testicle, and then the tunica vaginalis is going to be the serous membrane, which covers the testes. Next, now that we've talked about the flow of sperm, let's talk about the arterial and venous supply of the testes. So the pampiniform plexus is the venous plexus, which drains the testes. So something important to note is that the right and left testicle, as well as the right and left ovary, drain into different structures. So the right testicular vein and the right ovarian vein drain directly into the inferior vena cava, and the left testicular vein and the left ovarian vein actually drain into the left renal vein. And the right and left testicular artery and the right and left ovarian artery are branches off the internal iliac artery. So next, let's talk about spermatic fascia as well as the cremasteric muscles. So remember, we just discussed several layers of the testes, but something important to note is that these layers, the internal spermatic fascia, the cremasteric muscle, as well as the external spermatic fascia, so from superficial to deep, when you go from deep to superficial, it spells the word ice, and this is going to be important when we're talking about layers of the abdominal wall. being continuous with the spermatic fascia and cremasteric muscle. So the mnemonic ICE tie can be helpful because layers of the abdominal wall are going to be continuous with the spermatic fascia. So the I and T correspond together because the internal spermatic fascia is continuous with the transversalis fascia. So the internal spermatic fascia of the spermatic fascia is continuous with the layer of the abdominal wall called the transversalis fascia. The C, as well as the I, correspond because the cremasteric muscle slash fascia is continuous with the internal oblique muscle. The E's correspond because the external spermatic fascia is continuous with the external oblique muscle. So the external oblique in the abdomen will eventually become the external spermatic fascia. So that's it for this video. If you liked the video, please comment, like, and subscribe, and feel free to email us anytime at realtalkmeded@gmail.com for any comments, questions, or concerns.